What research minimizes levodopa side effects in Parkinson's? Levodopa is widely recognized as the most effective treatment for managing Parkinson's disease symptoms by replenishing dopamine in the brain. But it's not without challenges. Side effects like involuntary movements called dyskinesia, fluctuations in motor control, nausea, dizziness, hallucinations, and impulse control issues can occur. Researchers have been working hard to find ways to reduce these side effects and improve quality of life for patients. One of the main strategies involves combining levodopa with medications called peripheral decarboxylase inhibitors, such as carbidopa or benserazide. These drugs block the enzyme outside the brain that converts levodopa into dopamine. This means more levodopa reaches the brain where it's needed, and fewer side effects happen outside the brain, like nausea or heart issues. This combination has been a standard approach for decades and remains a key part of treatment. Adjusting how much and when patients take levodopa also helps. Starting treatment at the right stage of Parkinson's disease and carefully managing doses can prevent motor complications. Doctors monitor patients closely to find the balance that controls symptoms without causing too many side effects. Timing doses to avoid peaks and troughs in medication levels can reduce the chances of dyskinesia and motor fluctuations. Adding other medications can also help. For example, amantadine has been shown to reduce levodopa-induced dyskinesia by affecting glutamate receptors in the brain. Researchers are exploring drugs that target serotonin receptors to manage side effects without worsening Parkinson's symptoms. These adjunct therapies aim to make levodopa more tolerable. Another promising area is alternative delivery methods. Instead of taking pills, some patients receive levodopa through continuous intestinal gel infusion via a tube called a percutaneous endoscopic gastrostomy with jejunal extension. This method provides a steady supply of medication, avoiding the peaks and valleys associated with oral dosing. As a result, motor fluctuations and dyskinesia are often less severe. Surgical options like deep brain stimulation are also part of the research landscape. This procedure involves implanting electrodes in specific brain areas to help control movement. It can reduce the amount of medication needed and lower the risk of side effects, especially when medications become difficult to manage. Finally, ongoing research is exploring new targets beyond dopamine. Scientists are studying how other neurotransmitters and pathways contribute to side effects like dyskinesia. This research aims to develop new drugs that can control symptoms effectively while minimizing adverse effects. In summary, minimizing levodopa side effects involves a combination of strategies: using medications like carbidopa, adjusting doses carefully, adding supportive drugs, employing advanced delivery systems, and considering surgical options. It's important for patients to work closely with their healthcare providers to tailor treatments to their individual needs. As research continues, the hope is to develop even better options that make living with Parkinson's disease easier and safer. Always remember to consult your healthcare team before making any changes to your treatment plan.